Welcome back, everybody, to Loving Living Local. Well, the Shandy Clinic is a private therapy practice that specializes in individual therapy. And this morning, we're talking to speech therapy specialist Paula Forsyth about speech therapy for the kids and why it could be very helpful. Good morning to you, Paula.
Good morning. Thanks for having me.
Of course. Well, as a parent, this is an important topic. When should we start to think that a child could possibly need speech therapy services?
Well, you know, that's a great question because there are a lot of different things that speech therapists do. So it's hard to say there's an exact time when you should come in, but a lot of parents will notice that their child's language isn't developing in the way that their friends are.
Okay.
They might notice a different sound being produced for a letter, or they might notice that the length of their sentences isn't as long as their peers, or that their grammar within their sentence, the structure is a little different than what they're hearing from the other kids around them.
Okay, and these are things that as parents we could definitely look out for. Now, if my child is referred for a speech evaluation at the Shandy Clinic, what does that look like?
So once we get a referral from the doctor, you get a call from our referrals team and they set up an appointment, and we try to get you at the location that's closest to you, save you a little drive time, make it a little bit easier on the schedule. But we'll get you set up with an eval, and the first evaluation is going to be an hour-long appointment where you'll meet one of our speech therapists, and they'll give you some tests based on the concerns that you voiced to your doctor and you voiced to our referrals team during that first phone call. We'll talk you through the testing that we do, and we'll talk about what we're seeing as we're interacting with your child. And then that day, we will set up the next appointment so we can get you scheduled and start working on when you can come in and start seeing those improvements in your child's speech.
Okay, and you know, right now we're definitely seeing some interesting times of how some of these processes can be done. But let's say my child qualifies for services. What does a session look like, and how do you determine if it's going to be teletherapy or an in-person therapy?
So we've been doing a big balance of both of those right now. Some kids really are motivated by using the computer, and we've seen a really big growth in that area, which has been awesome because a lot of families aren't comfortable coming in right now. But really it depends on where the family is at, their comfortability level, but also how hands-on therapy needs to be with some of the kiddos. A big bonus of doing teletherapy is that the parents are right there and we can teach them to do the things we would do in a therapy session at home. Obviously, they're going to need instruction along the way, so we keep checking in, we keep doing those sessions together, but it really makes the parent the hero of the story. It allows them to do the things with their kid and not just say, hey, I'm only going to trust my therapist to do this for them. It empowers them, and we see a lot of improvement when the parents are really active in that therapy.
Yeah, you know what, you bring up a really good point. Now that you've been able to see both the teletherapy, the in-person therapy, how do you feel, do you feel teletherapy gets the same results or maybe even better as an in-person?
For a lot of our kiddos, it really does. A ton of them are working on their articulation, which is their production of sounds. And through the video, they can hear and see themselves better. A lot of the prompts and the things we're teaching them is where to place their tongue and how to move their mouth. And the video is so important in helping them see what they're doing and really gives them more self-awareness. And in that area, we've seen a ton of progress. But a lot of these kids are really excited to be on the computer and see us at our homes because for a while we've been doing some of our sessions from our living rooms, and it's really motivating to meet my cats. You know, the kids think that's awesome, and they want to ask questions about our houses and see our lives outside of therapy, and they want to share their homes with us too. So there's been a lot of language opportunities provided from just that new setting and that different environment that we're doing therapy in now.
Sure. So how does the Shandy Clinic ensure every child is receiving that individualized care that is geared not just for the child but also the family?
So like I said earlier, a big part of what Shandy does is making the parent the hero of their child's story. We like to think of ourselves as, you know, the character in the story who helps them along the quest. We are the wizard with the magic incantation, but only the hero can help their child get to the end of that story. So it's a lot of us talking with the families and finding out what their specific concerns are. The beauty of telehealth is that we're seeing them in that environment. We're seeing where some of those breakdowns happen, and we're able to really reenact some of those issues that they might be having. And it's just been really helpful to talk to those parents and talk them through those situations that they might not be able to show us when we're in the clinic.
Sure. Well, thank you so much this morning. Great information from you, Paula. And of course, if you would like to learn more about the Shandy Clinic, you can do so by hopping online. Go to shandyclinic.com for more. And this segment has been sponsored by the Shandy Clinic. All right, we'll be right back.